The outbreak of COVID-19 has created concern and worry, leaving many people anxious, afraid, and at risk of heightened levels of distress. COVID-19 has disrupted and severely restricted social interaction, which is of vital importance for keeping optimum mental health. In these challenging circumstances, it is crucial to find ways of enabling people to keep in touch with one another and to offer support even when individuals may be self-isolating or in lockdown. As the primary bastion of mental wellness and resiliency, the Aklan State University Guidance and Counseling Services Office (GCSO) policy statement is to help students, faculty, personnel, and the entire institutional community in facing crises, challenges, resolve psychosocial difficulties, and provide unconditional emotional support through a wide range of services that is geared towards educational resiliency and learning continuity. With this in mind, we had initiated this virtual psychological education video entitled ASU Resilience, GCSO Care, GCSO Assist, Psychological First Aid for Pandemic Distress, Anxiety, and Trauma.
The objectives of this psychological first aid video are to 1. Help ASU students, faculty, and personnel who are or has been diagnosed and currently quarantined due to COVID-19, recovered from COVID-19 but has traces of trauma out of the experience, grieving for loved ones who had died due to COVID-19, and experienced debilitating distress because of the overall situation and needs information and support. 2. Extend help in the form of providing information and capacitating skills necessary to normalize worry and other emotions, promotion of feelings of safety, calm and hope, and the ability to manage one's situation and make informed decisions. And 3. Advocate utilization of GCSO remote services such as counseling and other government linkages that provides in-depth intervention, active listening and extension of empathy, as well as practical assistance such as problem solving or access to other needs. Because of the restrictions on physical contact related to COVID-19, the Guidance and Counseling Services Office produced this self-paced psychological first aid information packet designed to instill clients with concrete awareness and relevant skills to cope with various distress associated to the current pandemic. This GCSO Care PFA is hinged on the assist model.
One is approach. Someone whom you are truly comfortable and share your frustration, distress, anxiety, or grief. The first step in any psychological treatment is the acknowledgement that an existing trouble needs to be addressed either by the person or in collaboration with someone. Communicating it out is an effective way of releasing the emotional tension in ourselves. Try to be as honest and detailed to your narrative in terms of what you think and what you feel. If you are in quarantine, try to talk to the medical staff on duty, your fellow patients if available, or through families and friends using virtual platforms or writing your thoughts and feelings in a journal or diary. Two is stabilize, specifically your emotions. It's difficult to come up with solutions to present difficulties. or thinking positively when overcome by negative emotions. It is important that the patient has the skill and capacity to keep emotions in check whenever it becomes too overwhelming and hinders one to be functional. For stabilization, some grounding exercises are advised, such as slow, deep breaths, mindfulness, sensing, butterfly hugs, or through calming music.
3. Serve. Serve your needs. If you feel you need medical attention or intensive care, you have to be upfront and vocal. Always prioritize your physical well being and fully disclose your symptoms or discomforts so that adequate diagnosis and treatment will be extended to you. Pay close attention as well to your other needs such as nutrition, rest and sleep, and do not allow these negative mental and emotional outcomes impair your daily functioning. By paying attention to your physical health and recovery, you will also do wonders for your mental functioning and well being. 4. Inform. Inform yourself with facts. Our anxiety, most of the time, stems from the uncertainty of the situation we are in. Being informed and acknowledging the statistics and facts will have a significant calming effect and reduce our tendencies to overthink and be overwhelmed in a situation. Be informed from credible sources. Be wary of fake news and conspiracy theories. Be updated on the medical bulletins given by your medical staff in your isolation facility. More facts, lesser worry, faster recovery.
5 is support. Support yourself with the emotional strength given by the people around you. Drawing strength from our social support systems could significantly motivate us to work for our recovery or to better cope our present difficulty mentally and socially. Regularly communicate with family and friends if in isolation to regulate your positive mood, affect, and vibes for recovery. If it's not possible, view photographs of loved ones or list down the things you want to say or do with your loved ones after isolation so that this will motivate you to fight on. Supporting yourself with spiritual or existential meaning will also be helpful to alleviate sorrows in your circumstance. Reading scriptures or testimonies of patients who recovered, families who undergone grief at the loss of loved ones in this pandemic will also be instrumental in your own psychological recovery.
5. Turn. Turn yourself toward further help services if problem persists. Not everybody has the individual capacity or personality to overcome mental and emotional difficulties on their own. And as such, if problem continues to persist, such as distress, anxiety, or inability to function in regular tasks, it is prudent to seek expert help to immediately arrest the psychological problem and avoid long term debilitating disorders such as depression or risky behaviors such as self harm. The Guidance and Counseling Services Office operates virtual platforms for students and institutional stakeholders for contact that necessitates counseling or coaching for whatever circumstance they are affected by this pandemic. National government and private hotlines are also available for supplementary psych education and support.
The GCSO PFA Assist model utilizes the ABC 123 activity that aims to assist patients in various COVID-19 circumstances stabilize and ground themselves to have capacities in coping daily distress brought about by this pandemic. In this ABC 1, 2, 3 activity, we will require your full attention and concentration. So first, find a convenient space. Implement a comfortable position, be it a sitting or lying down position. You may also get a notebook and a pen and write down our instruction, or you may just mentally answer and reflect on your responses. Listen to the soft music that we will play. Gently focus your attention on the music, tune, and melody. Gently wash away your worries, guilt, or sorrows. Again, focus your attention on the music, the tune, and the melody. Letter A is awareness. So mentally picture your body. Try to notice your body. Try to sense your hands, both of your hands, the left hand and then the right hand. Try to individually move your fingers from the left hand to the right hand. Try to feel your legs. Try to feel the sensations felt by your legs as well as your feet. Try to sense the pressure at the soles of your feet. Observe your immediate surroundings. Look around clockwise. Try to observe or notice the shapes visible. What are the different shapes found in your room? How about the color? How many colors can be found in your immediate environment? What are these colors? Can you identify the brightness? How bright is the light in your room? Notice the texture around you. What are the objects that are smooth and what are the objects that are rough? Observe your surroundings. Observe the room around you. Try to inhale these sensations going to acknowledge ourselves. Acknowledge your existence. Acknowledge that you are alive. Say that you are alive right now. Mention your name, that you are alive. Identify the place. Where are you at this present moment? Are you in isolation at home or in a facility? Where is this facility? Identify the place that you are in. Try to identify also the date without consulting the calendar or the cell phone. Try to recall what date do you think is today and what day. What is the date and what is the day? By your estimation, what time is it, do you think? Try to sense what time of the day is it. Okay, so this is all for awareness. We are aware of the things that are around us and we are aware of our existence. This is for the grounding. We are asserting our awareness. Okay, as we take in all this information, again, gently focus your attention on the music, the tune, and the melody. By this music, gently wash away your worries, your guilt, or sorrows, your grief if you are grieving right now.
B is for breath. This is called the five-finger breathing technique. In this breathing exercise, using your other hand's index finger, you are going to trace your fingers while you breathe in through your nose and breathe out through your mouth. You may start tracing from the outside of your thumb until you finish tracing your pinky finger. Let us now start. Gently focus your attention on the music, tune, and melody. Gently wash away your worries, guilt, or sorrows. C is for count. Write or mentally take note 3 things you see, hear, feel, smell, or taste. What significance or meanings did these sensations brought you? Gently focus your attention on the music, tune, and melody. Gently wash away your worries, guilt, or sorrows.
Okay, one is the one thing. You may elect to write this in your notebook or journal, or you may take note of this mentally. What is the one productive and positive thing that you can do today after this psychological first aid? Or what is the one thing you want to do or reward yourself after your recovery or after you overcome this current difficulty? Okay, so the number one is the one thing that is positive that you can do today, or the one thing that you are going to do after your recovery. So let us try to reflect on this. Reflect on the one positive thing. Let us make this as our motivation. Okay? Gently focus your attention on the music as we try to reflect on the one positive thing that we can do today. Allow the music to ease you in your reflection. Gently wash away your worries, your guilt, your grief, or your sorrows by coming up with this one positive thing that you can do for today. Write it down in your journal or mentally take note of it. Okay, we go to the number two. The number two is the strengths. What are your two strengths? Internal or and external resources that you can use that will help you recover or overcome your present difficulty. What are the two strengths that you have in yourself, internal or external, that you can use as your weapons, your shield and your armor that will help you recover or will help you endure your current self-isolation or if you are in quarantine. What are these two strengths that you have in you that you are going to hold on dearly and you're going to use it, that will remind you daily to be strong and to resource strength and resiliency to go on and to keep fighting in your present situation. So what are these two strengths that you have and that you're going to use in this personal adversity of yours? Write this down in your journal or mentally take note of it and remind yourselves every day while you are in isolation or while you are in quarantine or while you are in recovery. And again, we allow the music to help us calm our nerves, bring positive thoughts and positive feelings that will help us cope our daily battles. Gently wash away your worries, your guilt, your grief, or sorrows through this music.
3. Three things. What are the three things that you are grateful for? It could be large or small, that makes life still meaningful and worth fighting for. Gently focus your attention on the music, tune, and melody. Gently wash away your worries, guilt, or sorrows. Reflect on your answers. Promise to yourself to put them constantly at heart. Utilize them as your mental mantra and your emotional shock absorber as you fight on with your recovery. Endure the days in quarantine, picking up the pieces after grieving a loved one, or just getting by one difficult day at a time in the severe trying conditions.
Approach, stabilize, serve, inform, support, turn. Assist oneself, assist others. This is the unifying theme and mantra we need to cultivate in one another and in our ASU community so as we can collectively overcome the physical, mental, emotional, social, existential, fiscal, and occupational repercussions of this ongoing COVID-19 pandemic.
In support to Aklan State University's vision of being a leading university in the Asia Pacific region for global competitiveness and sustainable development, and the attainment of our ASU Light core values, we at the Guidance and Counseling Services Office, or GCSO, offers our services to our students and stakeholders through these remote and virtual platforms. Because we believe, together, everybody accomplishes more.
Together as ASU, we can row the boat in the same direction towards educational resiliency and learning continuity. Guidance
Guidance and
and
Counseling
Counseling Services
Services
Office.
Office.
We
We
guide,
guide,
we
we
counsel,
counsel,
we
care.
care. We
We are
are
ASU
ASU
Resilient.
Resilient.